Welcome to this tutorial on how to select a research topic in rehabilitation. Selecting the right topic is crucial for the success of your thesis. Rehabilitation is a vast field with several domains such as neuromuscular, musculoskeletal, cardiopulmonary, pediatrics, women's health, and sports physical therapy. In this video, we will explore how to identify a meaningful, focused, and researchable topic for your master's thesis. Rehabilitation has several distinct domains, which offers unique opportunities for research. Let's go over some major areas. Neuromuscular physical therapy focuses on conditions like stroke, spinal cord injuries, and MS. Musculoskeletal physical therapy deals with injuries like fractures, back pain, and arthritis. Cardiopulmonary physical therapy includes topics like pulmonary rehabilitation and exercise for heart failure. Pediatric physical therapy targets developmental disorders, cerebral palsy, and other childhood conditions. Women's health covers pelvic floor rehabilitation, pregnancy-related musculoskeletal issues, etc. Sports physical therapy is for injury prevention, treatment, and performance enhancement for athletes. Once you've selected a domain, explore common research themes. For example, in neuromuscular PT, neuroplasticity, motor control, robotic-assisted rehabilitation. In sports, PT, injury prevention, rehabilitation protocols, biomechanics. Key tip is to look for emerging trends by reviewing the latest research articles, attending relevant conferences, or speaking with experts in the field. Next step is to determine the type of research study you want to conduct based on your objectives. For example, cross-sectional studies are great for exploring the prevalence of a condition or trend. Randomized controlled trials, RCTs, are used to test the effectiveness of a specific intervention or therapy, and systematic reviews summarize the current body of research to identify patterns and gaps in the literature. Key tip is to choose the design that fits your study goals and the resources available to you. Start by choosing a broad domain in rehabilitation that aligns with your career interests. For this example, we focus on neuromuscular physical therapy, specifically stroke rehabilitation, a crucial area in improving patients' mobility and function after a stroke. Your choice should match your passion and future career goals in clinical or academic settings. Now that you've chosen stroke rehabilitation, it's time to explore potential research areas within this field. You might focus on motor recovery, balance and gait training, cognitive rehabilitation, or technology-assisted therapy. Select a theme that not only interests you but also has the potential for impactful research. It's essential to narrow down to a specific clinical problem. In stroke rehabilitation, this could be upper limb dysfunction, a common challenge for stroke survivors. Ask yourself, what functional limitations exist in stroke patients? Which part of rehabilitation needs more focus? After identifying a problem, research existing interventions. In the case of upper limb rehabilitation, methods like constraint-induced movement therapy, CIMT, and robotic therapy are commonly used. Understanding these interventions helps you see where further research is needed. To make an original contribution, you must identify a gap in the current literature. Focus on the introduction, discussion, and limitations sections of research papers to find areas needing further study. For example, you might discover that while robotic therapy is well studied, its effect on fine motor skills compared to traditional methods remains unclear. Before moving forward, assess whether your study is feasible. Do you have access to stroke patients and the necessary equipment, such as robotic devices? Can your research be completed within your thesis timeline? Evaluating resources and time is key to planning a realistic study. Search academic databases like PubMed or Google Scholar to ensure your research question hasn't been extensively covered already. Use keywords such as upper limb rehabilitation in stroke or robot-assisted therapy. This step ensures you're contributing something new and valuable. Based on your literature search, refine your research question. For example, you might ask, what is the effect of robotic-assisted therapy versus traditional physical therapy on upper limb function in stroke patients? Ensure your question is clear, specific, and answerable. Once you have a focused question, it's time to write a research proposal. Outline your introduction objectives, methodology, and feasibility. Be clear on how your study will address the identified gap in the literature and contribute new insights to stroke rehabilitation. Thank you so much for watching. Please like, share, and subscribe for more videos.